webinar. My name is Carrie Zoss, and I will be facilitating today's session. A couple quick reminders. We're going to kindly ask that you mute your microphone. We will have an open Q&A session towards the end of this webinar, and at that time, we invite you all to come off mute and ask questions, especially to our 3 nurse resident panelists who are joining us this afternoon. As a reminder, this webinar is being recorded and will be available on our careers website for the nurse residency program within about 48 hours. So you're free to go back and rewatch if there's anything that you missed. I do ask that you save your questions in the chat for our 2 facilitators, co-facilitators, who will be answering all chat questions. If you could kindly save those to our Q&A session. Our goal is to answer all of your questions during the webinar and just leave any outstanding questions for that Q&A session. So welcome. The goal of today's session is for you, the participant, to fully understand the Stanford Healthcare Nurse Residency Program interview structure, to understand the key features of behavioral style interviewing, and to be able to successfully articulate strategies to prepare for behavioral interviewing. I'd like to take a minute to introduce you to our team. Again, my name is Carrie Zoss, and I'm being joined by Leticia Cortez and Christy Norris, who are nursing professional development specialists at the Stanford Healthcare Center for Education and Professional Development. The 3 of us are the coordinators of the nurse residency program. We are also joined by our amazing colleague, Carly Dye in Human Resources, who works as a senior talent strategist to recruit exceptional talent. I'm very excited for you to meet 3 exceptional nurse residents who are active in our current nurse residency program, all representing 3 different specialty areas: Marvin Muthema, Duncan Clendaniel, and Pam McLaughlin. They are joining us now and will be available to ask questions to during our open Q&A session towards the end of this webinar. So who are we, both as an organization and as a nurse residency program? So Stanford Healthcare is a large academic medical center with more than 300 facilities throughout the Bay Area. We are the only level 1 trauma center between San Francisco and San Jose. In total, Stanford Healthcare employs over 15,000 people. Of that, 3,500 are clinical nurses. The Palo Alto campus has over 605 licensed beds, 101 licensed critical care beds, and 53 operating rooms. To get a sense of the footprint, the 500 campus alone, just going to ask everyone if they could kindly mute their mics.
And 4 is mental
incompetence.
Sorry. To get a sense of the footprint, the 500 peak campus alone, which is just half of our Palo Alto campus, is over 800,000 square feet. There are more than 450 life flight transports annually, approximately 72,000 adult emergency rooms visits per year, and over 2 million outpatient visits per year. So what does that mean? That means we are a very large, high acuity, busy, specialty academic medical center. So where do we fall as the Stanford Healthcare Nurse Residency Program? We are a recognized Vizient Nurse Residency Program since 2006 and follow the Vizient curriculum. Our residency program is nationally accredited through the American Nurses Credentialing Center. The ANCC sets the standard for residency programs that transition registered nurses into new practice settings. Our comprehensive 12-month program includes over 350 hours of clinical orientation with a dedicated preceptor, along with supplemental education and training seminars to support your successful development as a newly graduated clinical nurse. Our program is thoughtfully designed for you, highly motivated, determined, and compassionate new graduate nurses. Our overarching goal is to develop compassionate, committed clinical nurses who make a positive impact in the lives of our patients. We are aligned with the Institute of Medicine's 2010 Future of Nursing Reports recommendation, which was the implementation and consistent evaluation of nurse residency programs to support the successful transition to practice for newly graduated nurses. We are proud that we have supported and continue to support this transition into the following areas: critical care, emergency medicine, inpatient medicine units, inpatient surgical units, inpatient oncology units, dialysis, perioperative services, both inpatient and outpatient, clinical trials, and psychiatry. For our upcoming cohort, which is Cohort 40, which will start in March of 2024, we will be offering positions into 6 specialty areas: inpatient oncology, inpatient surgical, inpatient medicine, psychiatry, clinical trials, and inpatient float pool. You may note that this is a change from what was previously advertised. We will no longer be offering positions for this cohort into our critical care department. For candidates who selected critical care as their top preferred area, please know your application is absolutely being considered. We will be offering interviews in your next preferred choice based on availability. For our upcoming cohort, this is our current timeline. Ourselves, along with our partners in human resources, are currently reaching out to prospective candidates and inviting them to panel interviews. We have not finalized all of our panel interviews, so candidates are still receiving those emails. Panel interviews will kick off the week of January 29th. Following panel interviews will be unit or department level interviews. Unit and department level interviews will need to be completed no later than February 9th. All offers need to be made to human resources by hiring managers by February 9th, with offers extended to candidates starting February 9th. Of note and of importance is if a candidate is extended an offer, they will need to secure their active California RN license by February 16th, 2024. If you are unable to secure your active California license by that date, we will have to rescind that offer. The cohort will kick off on March 18th. So, the reason you're all here, let's talk about the interview structure and some strategies and tips to support you through this phase. We utilize a 2-phased approach to the nurse residency program interviews. The first phase is a virtual panel level interview conducted via Zoom. These interviews last approximately 1 hour in length. There are a total of 4 prospective candidates on the interview, as well as the hiring managers for that specialty. The interview features behavioral style interview questions, and we'll talk about that later in the webinar. Due to the number of candidates being interviewed on this panel, there is not an opportunity for individual questions during this interview phase. At the conclusion of this interview, candidates are provided next steps regarding phase 2, the unit, or also known as the department level interview. If a hiring manager would like to invite a candidate to a unit or department level interview, candidates will be called via phone by the hiring manager following the panel interview and are invited to a unit or department level interview. Unit level interviews are likely in person. Therefore, if you are invited to this interview, be expected to engage in an in-person interview. Unit level interviews are more intimate, with either 1 candidate or 2 candidates present during the interview. The structure of the interview is at the discretion of the hiring manager. There may be additional leadership members on the interview, such as assistant patient care managers, unit educators, clinical nurse specialists, and perhaps clinical nursing staff as well. Interview questions will be behavioral style interview questions in addition to candidate-specific questions. You will also have the opportunity to ask questions during this time. So we recommend you come prepared with questions that are important to you. Perhaps you want to know how preceptors and nurse residents are matched, or what makes a nurse resident successful. Or perhaps you want to know what some of the challenges of nurse residents have been on this unit, or what the orientation looks like. So we recommend you come with those questions that you really want the answers to. The panel interview process is quite simple. You will be provided a Zoom link for the specific time you were scheduled for. Of note, Zoom links are specific to interview date and time. So please do not share these, even if you have friends or colleagues who are on the same interview specialty panel. Our suggestion is you log in 5 minutes prior to the meeting. You will be placed in the waiting room. Once it is time for your panel interview, you will be brought into the main space and the interview will start. I'm just going to make sure everyone's muted. Thank you. At this time, hiring managers' introductions will take place, as well as some basic instructions about how the panel interview process will conclude. Then you will give the opportunity to introduce yourself. This is your time to shine. You will be asked to provide your name, your work history, any relevant work history, any relevant volunteer experiences, your school of nursing, and any other pertinent information that you want to share with us. This is your opportunity to connect and share information, and it is your first impression. So we welcome you to be excited to share who you are and share all those unique qualities and the unique experiences that make you who you are. We do remind you that our answers should be about 2 minutes in length, and so we encourage you to practice your introduction so you are able to keep it as clear and concise as possible. Behavioral style interview questions will follow. You will have to answer a total of 4 behavioral style interview questions. Note that interview questions are asked in a rotational sequence so that each candidate will have the opportunity to be the first to hear and respond to a question, but only one time. The remaining 3 questions that will be asked, you will have already heard as they were asked to another candidate on the panel. After all the behavioral questions have been answered, the facilitator will provide conclusions and next steps. These are our panel interview dates for your reference. As noted, critical care will no longer be hiring, and you will notice that the majority of our interviews will take place on Wednesday, January 31st. Hence why we ask that you not share your unique Zoom link, as they are uniquely tied to your specific interview time and date. As a reminder, we're currently sending invitations for interviews, and those interviews are going to the email address that was provided during your application phase. Once you receive an invitation for an interview and you have accepted a date and time, an auto-generated email will be sent to you within 24 hours of you scheduling that interview, and it will provide instructions and your unique Zoom link. If you do not receive that auto-generated email within 24 hours of scheduling your interview, please reach out to the following email address: newgradrn@stanfordhealthcare.org. You should have your Zoom link ready and plenty of time before your scheduled interview time and date. As a reminder, following phase 1, which are the panel interviews, phase 2 will occur, which are those unit and department level interviews. Those will conclude by February 9th, when all offers will be made to human resources by February 9th. So let's talk a little bit about behavioral style interviewing. Behavioral style questioning focuses on a candidate's past experiences. You will tend to hear questions phrased in a certain manner, such as, "Tell me about a time when," or "Give me an example from your previous experience." We utilize this style of interviewing because by asking candidates to provide specific examples of how they have demonstrated certain behaviors, knowledge, skills, and abilities in the past, we can best determine how that candidate will respond given the same or similar situation in the future. The questions we'll be asking What did you do? Rather than what would you do? Answers to behavioral style questions should provide concrete evidence as to how a candidate has dealt with a certain issue in the past. Again, this serves as the best predictor to determine how you will respond given a similar situation going forward. You may be prompted with a question and feel that I haven't had that experience. We don't recommend that you answer, I haven't experienced that. Instead, pause, think of your experiences, and respond to the best of your abilities. The questions are general enough where you would likely have encountered that situation. Remember, there's no trick questions. In the panel interview, you're not going to get a question on how you have responded to a patient having a myocardial infarction, or can you tell us the physiology of the heart? Rather, questions will sound more like, tell us about a time you had to respond to a patient who had a concerning clinical change. Now, our expectation is you have all had a variety of clinical experiences and have encountered a diverse group of different patients with different conditions, and therefore have observed or identified clinical changes. Clinical changes can be increased pain, it could be dizziness, it could be a change in someone's vital signs, or it could be stroke-like symptoms, right? Increased oxygen demands and work of breathing. It's not so much what the clinical change was, it's how you responded to the clinical change that the hiring managers are interested in. Behavioral style interviewing also allows us to assess the critical areas of the job requirements, but also those that are critical to our broader culture of our organization. So what does that mean? Not all questions will focus on, tell me about a time during your clinical rotation, but they'll also focus on questions regarding qualities of a clinical nurse at Stanford Healthcare. For example, questions about your communication style, or a time where you had to communicate effectively, or potentially questions about when you've had to work with a high-functioning team, or how you've had to work with others. Those are questions that look at the qualities of a Stanford nurse and ask for experiences in which you've demonstrated those qualities. So you may say, this is a lot of information. Where do I even begin? We recommend a three-phased approach, starting with preparing, then practicing, and then performing. In the preparation phase, we want you to think of the qualities of a clinical nurse, with you at the center of being that clinical nurse. This is a brainstorming activity that you can do. Think, what does a clinical nurse need to do? What are the qualities that they need to demonstrate? Perhaps they have to be really effective communicators. They need to be able to delegate. They need to be able to escalate. They need to be able to provide education, resolve conflict, provide service recovery. They need to be able to advocate for their patients' needs and provide compassion and caring care in an environment where they are making sure that they are expressing cultural competency. They also need to prioritize, right? And make clinical assessments, work on a team. Those are just some of the many qualities that a clinical nurse has. We invite you to do that brainstorming activity and then group those qualities together. There are a lot of stories and examples and experiences that you have that encompass many qualities at once. For example, a time that perhaps you had to communicate effectively. You may also have had to delegate and escalate at the same time. Therefore, you are demonstrating three qualities in one story. After you have thought about all the experience, all the qualities, we invite you to think about all of your experiences, clinical rotations, perhaps in your current work role, maybe in your classroom setting, volunteer role, all of those life experiences in which you have demonstrated those qualities. Once you think of those stories, next you're going to elaborate and say, what happened in that story and what part did I play? That's crucial because remember, you are the one being interviewed. So if you are part of the story and you are the center, that's great. But if all of a sudden the story shifts, perhaps your preceptor, and now they're driving the care and they're the one who is responding, and they're the one who's demonstrating the qualities, then the audience shifts to them. The goal is to remember that you are the one being interviewed, so you want to show how you demonstrated those qualities in that situation. And then you want to think, what was the outcome? How do I end that story? When you think of these responses, I encourage you to think of an Oreo cookie, maybe like a triple stuffed Oreo cookie, with the story and the outcome as the chocolate cookie, and your response, how you demonstrated the qualities, how you solved the problem, how you responded to the situation as the center part. That is the part that is being assessed. That is the part that's being evaluated. Your story is your unique experience, but how you responded to it, the creativity and innovation that you used, the resources that you utilized, what tools did you pull from? That is what's being assessed. So we encourage you to really focus on the action that you took and the response that you made when you were answering these questions. Next is the practice portion, right? We highly encourage that you practice before any interview. Review the stories and experiences that you have come up with so you feel comfortable with them. Choose stories that are not overly complicated. Usually, the more complicated the story, the more complicated the response, right? And that sometimes is difficult to articulate in a 2-minute window. So we encourage you to think of a story that answers the question and sets the scene, and then spend the majority of the answer with how you responded. Again, ensure you are that key player in those stories. We encourage you to write mock questions. You may think, how would I do that? Well, you take the qualities and you say, these are the qualities that I feel like represent a clinical nurse. And now I'm going to create a question. So if you take qualities of advocacy, escalation, and teamwork, you can say, tell me about a time when you have advocated on behalf of a patient or family member. Tell me about a time when you have escalated a clinical concern. Tell me about a time when you have worked on a high-functioning team, or on a time when you have worked on a team that wasn't high-functioning. You can create questions regarding the quality. We invite you to take those questions, write them on little pieces of paper, put them in a hat, and pull them out at random. This allows you to prepare for the element of surprise, which is usually the most stressful part of an interview, saying, I wonder what they're going to ask me, right? So do a run through at home multiple times. Have a family member or a friend ask you those questions where you don't know what the next question is, so you can kind of get your game face ready on how I'm going to respond, even if there's an element of surprise. We encourage you to speak out loud and in front of a mirror or a friend or a family member, or to record yourself for many reasons. One, when you speak out loud, you're able to hear yourself. And when you can hear yourself, you can say, I don't like how that sounded, or I'm rambling, and you're able to catch yourself. When you don't speak out loud, it's all in your head, and usually there's less rambling. Also, when you record yourself or speak in front of a mirror or to someone else, you're going to get the nonverbal feedback. Remember, an interview is 50% what you say and also how you say it. So you want to show engagement, and you want to connect with the audience, and you want to show that you're excited. So being able to see what your facial expressions are or your body language is critical. We encourage you to practice. The more you practice, the more comfortable you will feel just going into interview. What trips people up in interviews is the nerves. So the more you practice, the more confident you feel. Therefore, you're able to let your best self shine. When the nerves creep up, we're not allowing our best selves to shine, correct? So practice, get some of the nervous energy out. So when you come, the element of surprise or speaking out loud or answering a variety of different questions is no longer nerve-wracking, and you're allowed to be your authentic self. Lastly, there's the perform. This is during the interview. This is where what you've been preparing and practicing for. So position yourself in a quiet and comfortable space. that has limited distractions so you can focus. We encourage that you charge your device in advance, one less thing to worry about, wear professional attire, and then listen to each question. And if for some moment you didn't understand or you couldn't hear or your mind went blank, that's okay. Say, can you repeat the question? Don't answer the question unless you fully understand the question. If you feel like your nerves are starting to get the best of you, first breathe and then remember, interviews are simply a conversation of us trying to get to know you. The reason they're so nerve-wracking is because there's an outcome associated with them. So try to let the outcome go and say to yourself, this is a group of nurses who are trying to get to know me, and I'm trying to get to know them. Let's have a conversation. We also encourage you to interact with the panel. Show that personality. Remember, nursing is about that immediate connection that you make with patients. It is not scripted. It is on the fly. So you being able to connect even through a panel and show that you're excited to be there, listening to other people's answers, showing engagement is something that hiring managers are going to look at. During the panel, we are aware that you are hearing the answers of other candidates. This can at times be very nerve-wracking and intimidating. We highly recommend that you do not let someone else's answer influence or sway your answer. Remember, your unique experience is your unique experience, and it is not something that we're scoring. What managers are looking at is how you responded to that experience. So you may hear that someone had quite a glamorous story, and wow, I can't believe that happened, and I've never had an experience like that. Remember, that's not what the panel's looking at. The panel's looking at, how did I respond to my situation? It is in the response that you want to shine rather than selling the story. You may be asking, what are some examples of behavioral style interview questions? So we have provided some for you. In addition, when you're thinking about behavioral style interview questions, you want to ask yourself, what are they asking? What are they really asking me? Remember, it's not a trick question, but based on what they're asking, is there anything else I can tell them? So for example, tell us about a time during your clinical rotation when you identified a clinical concern with your assigned patient. What happened? That's the story. How did you respond? That's the action and the actions you took. And then what was the outcome? How did it end? So you may want to ask yourself some additional questions. Okay, here was my story. My patient had an acute 10 out of 10 abdominal pain. That's the story. How did I respond? First, I did a full assessment on the patient. I did a focused abdominal assessment. I listened to the bowel sounds. I looked at when the last BM was. I asked if there was any nausea. I took a set of vital signs, looked to see when the last pain medication was given. But then what else did I do? Did I talk with the provider? And in which way did I talk with the provider? Was it via an SBAR? How did I communicate that situation? Did I have to provide any education to the patient on what was going on? Did I escalate this to my clinical nurse? And how did I do that? If I was concerned about this patient, what about my other patients? Did I delegate their needs to someone? So the situation is saying, tell us about a time when you identified a clinical concern with your patient and how did you respond? So how did I respond to that moment? And was there anything else that I did that maybe affected the care of someone else, communication with someone else, escalation with someone else? So ask yourself, what else did I do during that situation? Another question, tell us about a time when you needed to communicate effectively to a member of your healthcare team, a clinical colleague, a nurse, a provider, regarding a change in your patient's condition. What happened? So what happened that I needed to communicate a clinical change? What actions did I take in this communication and what was the outcome? So what was my communication style given the change? Was it an urgent situation? So the communication needed to be urgent, brief, a very quick SBAR? How did I choose that style and why? Did I need to prepare? Perhaps I needed to communicate to a clinical colleague a very long handoff report, or I needed to communicate discharge instructions, or I needed to communicate what the plan of care was given a family meeting. So how did I prepare so that I could communicate effectively to that individual? And then during my communication, how did I understand that my audience was receptive, that clinical colleague was receptive to what I was saying, was understanding? Did I have to pivot? Did I have to make any changes based on how they were responding to me? Ask yourselves all those questions, because when you ask yourself those questions, you can really dive deep and say, what did I do that was super innovative or creative or dynamic to really answer this question? Another question might be, tell us about a time when you received valuable feedback to enhance your practice. We all know we've gotten feedback, whether that's a clinical instructor or a preceptor or a colleague or someone in my job role, someone in my theory class. Feedback is everywhere. So what was the feedback? First, tell us what that was. And then how did I respond in that moment? Did I react or did I respond? Was I defensive? Did I show gratitude? And then how did I learn and integrate this feedback? What did I do? So if my preceptor said to me, Carrie, I just listened to your shift report and I found that you didn't have a sequence. You went from why they were here to allergies to neuro to that you replaced their electrolytes to pain assessment back to pulmonary assessment. You were all over the place. My feedback is that you need to deliver a handoff report that is sequential. And so how did I respond? I agreed with my preceptor. I asked if they had any strategies, perhaps that would help me. Then I asked some of my colleagues in my clinical group if they had any suggestions. I went home, I changed my brain sheet to allow me to have a flow. I practiced with my sister over the phone and made her listen to, mock handoffs. Maybe I YouTubed how to give an effective handoff. And then when I came back to clinical, I asked my preceptor, can I run handoff with you before I give it to the oncoming nurse? And then you can say, this is now what I've done. So it shows all the things that you did to respond to that situation and now how I've changed my practice. And perhaps you've learned more about feedback and the necessity and the importance and the impact that feedback can have. So maybe, yes, in that moment, I learned how to give a really effective handoff, but I also learned the importance of feedback and how that can really help me grow in my profession. So a couple strategies for during the interview. Again, listen to the question fully, ask for clarification if you need it. Don't answer the question if you don't understand what is being asked. Ask for it to be repeated. We're not trying to trick you. Try not to overcomplicate, but do know that the questions usually have multiple components, usually 3. What happened? What was the response or the action? And then what was the outcome? Take a breath. Try to keep yourself relaxed during the interview. Don't rush your answer, but ask yourself, what are they asking me? I want to make sure I'm answering what they're asking. If you need to, write down the question if that will help you. No trick questions. Do your best not to answer, I don't have a situation where this occurred. Remember, these are general questions. You should have experienced some sort of situation in which you can describe the qualities that they're asking. You are all highly dynamic individuals and you have vast experiences from your clinical rotation and your academic setting and perhaps work experience, volunteer experiences, life experiences, and we invite you to share all of that. The one thing we want you to remember is that you are interviewing for the role of a clinical nurse. And so it is incredibly important to share some experiences in which you were in the role of a clinical nurse. For example, if I'm a nursing assistant all throughout my Bachelor's of Science program, and I answer all my interview questions about me being in the role of an NA, or I work as a coffee shop barista all through my master's program, and I answer all my questions as when I have been a coffee shop barista and the qualities that I have demonstrated, it's difficult for the hiring manager to see you in the role of a clinical nurse. So we recommend that you're very intentional with ensuring that some of your answers include when you have been in that role of a clinical nurse. So those would be your clinical rotations. Try to bring your best self. I know it's hard when you're nervous. Do not read answers. We know that you will prepare and you'll take notes, and we think that's amazing. But when you come to the interview, you are coming as your genuine self, off script, because that is what a true nurse does. Nothing is scripted. Do not read. We know when you read. You probably are all watching this, seeing when I'm reading and when I am not reading my notes, right? For you, don't read. Individuals who have come to the panel interview and have looked to the side or looked up, and although very articulate and very clear, but have read stories and answers that they have rehearsed, have not been successful. The reason is it doesn't allow you to connect with your audience, and the focus then becomes on reading versus showing who you truly are. Again, 50% what you say and 50% how you say it. So if you stumble a little bit, if there's a couple, if you need to pause, that's okay. That's life. That's expected. You are trying to talk off script and answer to the best of your ability. That will serve you more than coming and reading. Again, try to connect with that audience. Don't be swayed by others' answers. And remember to showcase your unique talents and abilities and how you've demonstrated them. Be true to yourself. Allow that human-to-human connection to shine. Prioritize and focus on those nonverbal cues. Be proud of your story. Remember, we're not looking to hire the same person. What makes us different is what makes us great. So if your story is different and your experience is great, look at that as a positive thing. And at the very end of the day, remember, it's just a conversation of trying to get to know you and for you to get to know us. I know that was a lot of information. I want to thank you for your attention, and I want to invite you to our open Q&A session. We have 3 amazing clinical nurses who are joining us today who have recently walked in your shoes. So I invite you to ask them questions about how they prepared for their interview, what their interview experience was like, what their strategies were to being successful during their interview, maybe how they kept their calm and kept those nerves at bay, and then also what has made them successful in their transition to practice, challenges that they've had, all those burning questions that you have. So before I turn it over to our audience, I invite and ask our 3 nurse residents to come off mute. Maybe Marvin, we'll start with you, and then go to Duncan and Pam. Introduce yourself, your school of nursing. There will be some connections, I'm sure. And then and your unit and specialty, and then briefly share what made you, what you felt made you successful during that interview phase. So Marvin, I think we'll start with you.
Okay. Hi, everyone. My name is Marvin Muthima. I am currently an RN on C1, which is our observation unit. I went to nursing school in Florida. I took a very non-traditional route. I did an online / in-person hybrid program where I relocated to Florida to do my clinicals, but did most of my classes online during the pandemic. What were the other questions?
And then what did you do to prepare for your interview?
To prepare for the interview, I essentially just kind of went back and watched this webinar maybe 2 more times, because everything Carrie said is just really great advice. And watching it back helped me just kind of remember what it is that I'm looking for. I just tried to think of scenarios off the top of my head that matched what the question was asking, and try to have like multiple for each one. And then after I had them written out, I tried to kind of expand on them, hit those talking points to get the whole scenario and how I went about it out. And as I went into those scenarios, I was able to find which ones worked best. And also just practicing and figuring out how to take the fluff out of your answers and really just giving them what they're looking for. It was really just remembering scenarios in clinical settings and outside of clinical settings well in different jobs that I've had that weren't nursing, but I was doing to get into the healthcare route. That was kind of a big one for me because I didn't have a whole lot of like nursing under my belt. I was more of like in social work type of area. So I used a lot of scenarios from there, but it all really tied together. And just remember, you're trying to show them how you respond in those scenarios, not necessarily like how you save the day. Just what did you do? What did you learn from it? What did you take away? How can you be better? Things like that. Yeah.
Thanks, Marvin. Duncan, same questions for you.
Hello, everyone. So yeah, my name's Duncan Clendaniel. I work on J7, which is the cardiac medicine unit. So primarily cardiology, heart failure, arrhythmias. We get LVADs. Really cool unit. So I went to San Jose State. Go Spartans. Hopefully some of y'all are here. And then as far as preparation, I just want to kind of acknowledge, I think a little bit of like two things. I think one, I want to kind of acknowledge the numbers game that y'all are kind of looking at right now, where there's 300 people on this interview and there's not 300 spots unless Carrie can adjust that. And that gave me a lot of like stress and anxiety. So what I did was try to get my mind right. Was I did a lot of like exercise before my interview. I went for a walk. I would go for runs. I'm a jogger, so I would like try and like think through things as I was running. That's what works for me. You probably have a better idea of what works for you. And then the other thing is when you get into the panel, do not play the numbers game, because when I went into my panel interview, and you can't help but like hear the other people and what they're saying. And some people are just like really, really well spoken, really eloquent, have amazing stories. And you just have to kind of acknowledge that and speak your own truth. And what I can tell you is that, there were 4 people and I was sitting in that interview being like, oh my God, that person, they're so amazing. That person, they're so amazing. If I was a hiring manager, I would pick that person. I would pick that other person too. And as it turns out, there were 3 people from my interview who all end up in our cohort, one of them being Mavin. We were in a panel together, which was really memorable. She's incredible. And then another young woman named Bavin. So just because there are other really, really impressive people in your interview does not mean that you're not going to get picked. So that's kind of that's my starting advice for y'all.
Thanks, Duncan. And then Pam, same questions for you.
Okay. Hi, everyone. I'm Pam McLaughlin. I work on an acuity adaptable unit C3. So it's inpatient medicine. It's like med surg, but we care more on the medicine side of things rather than people who are coming in and going with surgeries. What else, Carrie?
Your school of nursing, and then how you prepared for your interview.
My school of nursing. Okay, I went to San Joaquin Delta College in Stockton for my ADN program. I then jumped immediately into my RN to BSN at Sac State and graduated from there this year in May. And so I just remember these interview sessions because I went through this process twice. I applied during my last semester of my ADN program. I got the first interview and I was not myself. I knew I wasn't going to get invited back for a unit interview, and that's okay. Decided just to go for my RN to BSN, and I applied for Cohort 38, which I luckily got in, and I knew what to do at that point. So I cannot emphasize enough that these stories, they don't have to be anything crazy. I'm sorry, I have a cat foot in my camera. These stories don't have to be anything mind-blowing. It's just they want to know who you are, how you respond, and just take a shining characteristic of yourself and weave that into each story, and it'll be much more natural for you to remember all the bits where you did shine. The STAR method, so you might have heard of that for interviewing: situation, task, action, and then the result. I just had a Word document. I had about 5 stories, and I just tried to make them as concise as possible to fit in that 2 minutes. And I just practiced them over and over. And like a practical kind of thing, I turned off my self view as for my second go with my interview. And that helped me so much not to just stare at myself, because I was giving myself anxiety just looking. So that's what made me successful, I think, is just focusing on really what my personal strength was in each story, and engaging with the panel too. So there was a girl that introduced herself, and she kind of framed her schooling as, well, I don't have a bachelor's degree. I just have an associate's degree from this school. And so I was to introduce myself next. And I'm just like Jane, I have an associate degree as well. So I just wanted to show that I was paying attention to what others were saying, as well as supporting her in that moment, because I could tell she was a little nervous and maybe feeling underprepared with her associate not having a bachelor's or master's. So just a little camaraderie.
Thanks, Pam. So now I open it to the 307 of you who are on this call. I know you have questions. Michelle, I always love when there's a first person. Okay, Michelle, kick it off.
Hi. Yeah, I had a question. I'm not sure who best to direct this towards, but I'm wondering if the unit managers in the panel, if we can expect that they've already read our essay responses and our application, or are we just like a blank slate to them?
No, they have all of your information. They have,
Oh, awesome.
The minute you accept an interview, your information, your profile is routed to the specialty area in which you will be interviewing. So they have everything you submitted. And so individuals usually ask, what if there's been a change? Like, what if I have my RN license now and it wasn't on my resume? You're welcome to say that in your introduction, but it's not a requirement, your RN license, to apply. So managers know, like, people aren't going to have their RN license, or ACLS is not a requirement to apply. So they're not looking for ACLS on the application. Offer is different. So don't feel like unless there's a big change that you don't need to send like a new portfolio.
Okay, I guess I was worrying more about like repeating stories, I guess. So if they've already read everything in our essays, then I guess was just wanting to not be repetitive in answers to interview questions.
Yeah, I think if you have a really unique story that you're really proud of, especially like your compassion and caring story, because I know that's one of the questions, and you can expand on that a little bit, they will not hold it against you that you use the same. It's not like, nope, already read it, they're not moving on. What I do say is the more information you can provide and the more experiences you can showcase, the more information they'll have at you. So it may serve you to be like, they already know this about me. Let me show them again how I've done this in a different way.
Awesome. Thanks so much.
Sure. Okay. Is it Nilo?
Hi, yes. I had a question about the introduction part. Can you elaborate more on that? How personal do you want it? How much education-wise do you want it? Experience-wise?
So I'm going to let our panelists, Duncan, Marvin, or Pam, do you remember how you introduced yourself and what you shared?
I can answer that. I just kept it really brief. My name, my schooling, where I was from. What else did I say? It was really brief. It wasn't like 2 minutes, like how your answers are supposed to be. It was maybe 20 seconds. So just keeping it brief, really. Just if you want to share your interests or hobbies, I'm sure that's a nice tidbit for them. I just shared that I had cats. So it's very, very brief. I don't know, Duncan, Marvin, how did you guys do your intro? Do you remember?
From my recollection with my intro, I shared the things that I felt like led me to here. So like I have a bachelor's in psychology. That's how my education started. I shared that. And then I shared the process of how I got into nursing. I worked as a health case manager. And I felt like that was important for that situation, just because I knew, I was coming into this with an ADN as well. So I was feeling a little nervous about it. So I was really just trying to showcase, okay, I may not have gone to this top school that some of my peers may have gone to, but I have really important, experiences that I think are going to make me a great nurse. So I just try to throw those things in there. Because a lot of people are going to have different careers before they get into nursing, and all of those things are going to shape the kind of person you become, the kind of nurse that you are. So if you feel like it's pertinent and it just gets them to understand more of who you are, the kind of person you are, the things that you've done that have gotten you here, then I think it's important. If you're a parent, whatever your story is, if you're an immigrant, like, I think those things are all really important. So I shared as much about myself personally as I could so that they can get an idea of who I was, just without what they're seeing on my resume and my cover story.
Yeah, I think I would probably say I kind of went more of Marvin's approach. I honestly think that you have 2 minutes and you only have 10 minutes to talk the entire time, right? So you got to make the most of that time as best you can. And I really truly think like a 10 out of 10 introduction will help you create that connection. And let the folks who are interviewing you know a little bit more about yourself than what comes across on your resume. So for me, I highlighted a couple of things on my resume. Again, like what Marvin was saying, like, this is a second career for me. So I talked a little bit about my background. I talked a little bit about what I did in nursing school, as far as extracurriculars. And then I talked about my family because I'm a dad, and that's a huge, important part of who I am, just as a human. So,
and I do remember that, Duncan.
I was going to say that.
Yeah.
I thought you were leading me
Yeah.
there. I appreciate that.
Yeah.
Thank you so much. That was actually really helpful. Just one more quick thing. The Zoom kind of gets me. I prefer in person so much better. I never know where to kind of look. So I'm kind of glad they brought up hiding the self view, but also it's like, it feels kind of awkward sometimes.
I would agree with you. I encourage, as these 3 residents know, I encourage you to embrace the Zoom. I tell everybody, come off, let's see who you are, let's interact, because looking at these 3 individuals, you can probably see why they were offered positions. They engage, they smile, they talk to one another, they laugh, they have a cat that's pawing at their camera. They're like human, see, cat, they're human beings. And so getting yourself more comfortable, don't worry so much when you're nervous. People kind of look down or they look to the side. That's okay. You're human. It's the reading piece, and you can tell when people read. So if you have to pause, if you say, we've had people who say, can I start over? And we go, yes. And they have been hired. We've also watched people answer a question and they look completely defeated. Like, that was the worst answer I ever gave. And then they come back and reset. And when we've called them for a follow-up, they will say, I can't believe I got a follow-up call. And the manager has said, I liked how you were able to say, that's not how I want to answer, but I'm just going to shine for the rest of this interview. So every question is a new opportunity for you to showcase yourself. So you may have an answer, especially like your first question, where you're like, oh, that was hard because it's the first and it was new and I'm nervous. Don't let that set the rest of the interview. Every question is another opportunity. Okay, Noah.
Hello, my name is Noah, also from San Jose State, so shout out Duncan. My question was, is it possible to be invited to multiple department interviews, or is it like once the hiring manager calls you, like you're stuck to that like region, if that makes sense? I'm not sure if that made
So
sense.
your panel interview is by specialty. So if you are invited to oncology, you're going to interview in oncology and only oncology. And then the unit level interview will be,
Right,
let's
okay.
just say there's 5 managers oncology. They'll review all of the candidates and you will get 1 phone call to interview on 1 unit.
Okay, so it's just 1 unit that,
Mm-hmm.
okay, so you basically have 1 chance for 1 unit. There's no, like multiple units can't get you. Okay,
Yep.
sounds good. Thank you.
Sure. Mary.
Hello, good morning. Can you hear me okay?
Yes.
Okay, perfect, because my camera's not working at the moment, sorry. But yes, you mentioned to keep our responses within the 2-minute mark, right? And my question is, will the interviewer somewhat remind us of if we're about to approach our 2-minute mark? And if we have to start over, say, we we want to restart how to answer the question, will you, or does a 2-minute mark restart?
So we do not time you. That is a commitment. We know interviews are stressful enough. So there is no timer clicking away or anyone who's like, sorry, Mary, your 2 minutes is up. So you're done. Absolutely not. You'll answer freely. If you are 4, 5, 6, 7-minute responses, what the facilitator is asked to say is after you finished, a gentle reminder to try to keep your questions to about 2 minutes. That's it. So don't feel like someone is looking at the clock. It's one of those things is we want to invite people to feel comfortable enough to share. But what happens is we find that they share their story for like 3 minutes. And then their response is very brief on how they responded to that story. And then the outcome is very brief. So we're trying to shift it and be like, the story is not the central focus. And that usually is what people take the longest to explain. So keep it very simple. And then your response is the meat. And then the outcome is very simple. But you're not timed. So try not to focus too much on that when you practice. If you're like, oh, that was 2.5 minutes, or oh, that was 3 minutes, it's okay. If you're noticing like I'm at 5, 6, and the majority is telling a story, perhaps that story is too complicated, or figure out what's happening because you want to capture the attention of your audience. Is that helpful?
That's very helpful. Thank you so much for clarifying that.
Elaine, question from you.
Hey, my name's Elaine. I'm also from San Jose State as well. So I do have a question in regards to behavioral style writing, interview questions. The 2 questions that was shown was kind of similar. Do you think it would be okay to say the same scenarios, like use the same scenario situations?
I will answer quickly and then I'll let the panelists also answer. The questions are divided into 4 domains. So you should not have the ones you probably saw were from the same domain. So you won't, for example, there's a domain on caring science. So there's questions on compassion, empathy, advocacy. You're not going to get 4 questions on that. You're going to get 1. So they should be not alike. Does that make sense? Where you'd be like, I feel like I just answered that question. We wouldn't want to do that to you. In terms of using like the same scenario, but taking same scenario, different response, I'm going to leave that up to our panelists. What are your thoughts?
I ran into this too when I was going through the panel interview. It's so nerve-wracking, I'm not going to lie. I'm like, oh man, should I burn the story on this question, or should I use it for another one just in case? Because I really know that story. I feel like you probably could use the same like situation, maybe, where you just relate it back. What I shared earlier about this also happened. If it's if you already have the story laid out, so you could just say, here's what I did in response to this during a different part of like the patient care or something. You probably could, but in all honesty, I think that you'll find you're going to have enough stories prepared to fit the situation, so you could have a different story for each question. So yes, maybe, but I personally didn't do that. Did you, Duncan, Marvin, did you guys use the same story twice?
I feel like there's no cookie cutter way to do it. So if you feel like there's a way that this is just the best story that tells these 2 situations, just find a way to give them new information. But they're only going to have such limited opportunities to hear from you. And you have so many experiences in your whole life that if it means that you need to step out of a clinical answer and maybe use a different scenario, maybe something that happened in school with a professor rather than like your clinical preceptor, that could be an opportunity to talk about it, because all of these things intertwine with how you work with others or things like that. So I think just encourage or, employ yourself to maybe find a different area in your life that would still showcase that really well. Yeah.
Yeah, totally agree. Kind of what Carrie was saying earlier, like if you're struggling, like pause and think and give yourself that grace to like have a little bit of time and be like, okay, Let me consider what will best represent me. What I will add is I did use the same story from my panel to my unit level interview. And I just kind of acknowledged, and I was like, hey, Bernadette, who was the manager who was on the panel, I was like, hey, you've already heard this story, but just so everybody else can hear it too, because I thought it represented me pretty strongly. So I wanted everybody to hear it. So that's what I would say. Yes, definitely go use that story again, is in the unit level, because they all haven't heard that story before. So you're good.
Sounds good. Thank you so much.
Heather, question from you.
Hi there. This is for all the panelists. Did you know what area of nursing you wanted to be in right after school? And was that the department that you applied to and the one you're working in now? I know.
All right, I'll start.
Both parts. Sorry.
I knew I wanted to work at Stanford, and I did not care where. So that was my goal, was to get a job at Stanford and then figure out what specialty I wanted later. And it just so happens that I got into a unit that is amazing and incredible, and I am so happy that I'm here. So that was me. I had different ideas in my head of what specialties I wanted, but Stanford trumped those other specialties. So
yeah, for me, I would say that I wasn't sure what specialty I wanted to go into. I had ideas of, all the different things that I've heard or, looked at online of what kind of nurse I would like to be. But I didn't feel like my nursing school gave me a wide variety of opportunities to really know, okay, this is the kind of nurse I want to be. This is a specialty I want to go into. So similar to Duncan, I was open to wherever they chose me. I ended up going to C1, which is an observation unit. It's different than some of the other units because we get patients from after surgery, like they come into our unit after the PACU, or we'll get patients from the ED. So it ended up being a really great experience. I didn't know when they said, okay, C1 observation, I was like, I have no idea what this is. But of course, I got to the next step. I'm going for it. But it's been a really great experience because I see a wide variety of different patient issues. It's all medicine based and a little bit of surgery as well, but just a lot more stable patients. But I think down the road, it's going to help me get a better idea of what kind of specialty I would want to go into. And then once you get further into the process and you have opportunities to float to other units or just go to other units, that can help you see if other things interest you. But all I can say is if there's one thing that you're set on now and you don't end up getting it, keep a really open mind because it all comes together. Yeah, there's a lot to learn in nursing.
Okay, so my answer is equal parts of Duncan and Marvin. So anything Stanford, I was like just absolutely thrilled to be offered a position. Med surge, during your clinicals, of course, intimidated me because it's just so much, and you don't really get the whole nursey feel when you're there because it's really hard. I mean, the nurses are doing their own thing. They're not really. It's really hard now being a nurse and working as a nurse. You're like, oh wow, I can't imagine having this little newbie following me around at this point. And so it's not the same as working as a nurse. So med surg, I was like, it wasn't highest on my list when I ranked what I wanted. I think I was like, I don't know, ICU was probably one of my top ones, but I got chosen for medicine, inpatient medicine. So my patients, all the like med surg floors are acuity adaptable, so they all have tele. They can go, there's like step down units as well. So you could have intermediate ICU patients, which require more frequent care, more intense care, or you can have patients ready to discharge. So I am so grateful for where I'm at now because I've kind of overcome my fear of med surg. And 9 months in, I feel like my skill set is pretty sharp now. And I'm just so looking forward to like building on that and figuring out where I want to go. Will this floor or this kind of nursing be forever? Probably not, but I'm going to stick it out because I'm really excited to see the growth, especially within the last couple of months.
Thank you. And I will add on that Stanford doesn't just want to hire you as a new grad. We want to hire you for your entire professional career. And so there is a lot of support for growth and transition. And so these 3 individuals in their next 2 residency program seminars will be going through professional development because they're almost done with their residency program and seeing what are some opportunities as I continue on this journey that I may be interested in. Is it specialty training, going to the ICU, going to the ED, going to oncology, going to a procedural area, right? Is it furthering my education? Is it teaching? Is it becoming certified? What does that look like? And so I agree with all of them. And Letty and Christy on the call can say this, your entry point, same with mine, I was in cardiac surgery, doesn't necessarily mean that's where you're going to end up, right? So I started at Stanford many years ago as a new grad. Before we really had a new grad program, I didn't think at that moment that 18 years later, I would be working with 2 wonderful colleagues running the new grad program. And so part of that beauty is like kind of taking, not necessarily a risk, but just taking that opportunity and seeing all the different paths. Because you may say like, I really want to be an ICU nurse. And then you come in and you're like, actually, I really want to go into education, or actually, I really want to be one of the crisis nurses, or actually, I'm really interested in life flight, because maybe there are things that you didn't have the opportunity to be exposed to previously. And so now you have, and so that's another opportunity. So it's always good to have those goals, but it's also to say like, what else is out there that I can explore? And perhaps my goal will change based on that. So Heather, did that answer your question?
Yeah, thank you, everyone. Actually, that was really encouraging and kind of makes it feel better, less pressure. So thank you.
Good. Okay, Julia.
Hello, I'm Julia. I think this question is directed to Carrie in addition to the panelists too. I'm just curious about when we show up for interviews, does Stanford more so take you in or assign you to a department that's based on your previous experiences, or is it more so based on what I would like to experience? And kind of the reason I'm asking this is because I have a lot of background in like psych, and I feel like through other interviews, I've always been more so pushed towards the psych department, and I really want to branch out into other departments that I haven't experienced through nursing school. So I'm just kind of wondering, what is the kind of the goal, or how Stanford kind of would assign us to the departments?
So you are hired into a unit by the hiring manager, and then you participate in our residency program. So from day 1, you are an employee of Stanford Healthcare. In terms of how we assign you to a panel, it is based on your area of preference. So you will only be assigned within your top 3. Don't believe in being like, well, that was Marvin's 8th choice. Let's have her go work there. If it's your last choice, it's probably where you don't really want to work, right? So you'll only be assigned within your top 3, and it's based on score, where you scored. So you will hear, for example, we will have a very high number of individuals for one specialty. So when the emergency department is hiring, I will say 50% of our candidates choose the emergency department as their preferred area, right? And so the cutoff threshold score is actually very high because there's so many people who apply to that area. So it's score driven and then area of preference driven. Now, when we look at surgical 1 versus surgical 2, because we have 2 surgical panels, we do look at some of your clinical rotation exposure. So for example, if you had a capstone in trauma or ortho, we will put you towards that specialty, but you chose surgical. If you are more cardiac, thoracic, we'll push you towards that panel. Because we also want you to be successful, right? So if you have an experience in something, we want you to be able to leverage that. And if you're saying, I want to be a surgical nurse and I had a bunch of clinical rotations in cardiac surgery, it gives us insight that you must have had a good experience in those clinical rotations to still want to pursue the surgical area. So But if you are a, you know, nursing assistant in inpatient psychiatry right now, but you don't want to work in psychiatry, we don't put you in psychiatry. Like, we respect those top 3 choices. Is that helpful?
Yes, thank you. It's
Yeah.
kind of like we're entering, at least for me, for nursing, it's so broad and I want to try everything. So that's very helpful. Thank you.
Angelica, question from you.
Hi, first off, thank you guys for having this webinar. Definitely appreciated all the information that has been provided thus far. And Pam, thank you for the cat. I literally just put my cat in the laundry room because she is so loud. So thank you. So my question is in regards to the 40th cohort not having critical care being an opportunity. I wanted to know, given that I put that was my preference, my number 1 choice, what or how do you guys foresee the 41st cohort opportunity? Like, will that be provided during that time? Would you recommend waiting, or would you recommend just continuing to go forth? And then in addition to that, in regards to professional development, let's say, for instance, I am selected for another one of my choices. How do you guys see professional development? Let's say I still want to go to critical care. How do you guys foresee that time-wise?
So I'll answer part of that and then I'll defer to our panelists. So the critical care region is not hiring because they don't have positions for clinical nurse 1. So essentially, the way we are able to hire is when there is an open position. So people leave, we take those positions, a certain number go to the residency program, a certain number go to additional transition to practice programs. The critical care training program, we have an oncology training program, we have acute care transition program. So there's an allocation for that. So there was no position in the critical care area for nurse residents. So that's why they are not being hired for cohort 40. It's difficult to determine what cohort 41 will look like. I can't say yes or no because it's based on the availability of positions. If there's not a lot of movement within the organization, internal movement, there's not going to be a lot of open positions, right? There will not be a hiring need. If there's more internal movement, then there's an increased hiring need. So over the last couple of years, our footprint has grown, right? We opened a whole new hospital. And so the hiring needs were increased. And so all of our transition to practice programs were able to hire in all areas. And now we are kind of ebbing and flowing. And you'll see that sometimes psychiatry is participating, sometimes the ED is participating, sometimes the operating interventional platform perioperative space, dialysis, it ebbs and flows based on position. So difficult to tell you what 41 will look like. I'll let the panelists answer whether you should wait. I will say every transition to practice program has different requirements on length of work experience before you can apply for their program. So for example, my understanding is the emergency department, it's 2 years acute care. The ICU is a minimum of 1, 2 preferred. So they have different requirements, but I don't feel like they are that challenging. It's not like you have to be here for 10 years. I think you can move and learn and grow within that 3 to 5 year period pretty seamlessly, and people want to support you in doing so. But I'll leave it to our panelists. Would you wait for a specialty area? What are your thoughts?
I would not wait. If you're offered this opportunity, it's, you're up against hundreds of others, and going through it twice personally, I wouldn't have wanted to do it again. I mean, didn't want to do it the second time, but Stanford was really important to me to work there and start my career and build my career. So I'm one of the people where I didn't enter under what I thought I would, specialty wise. I eagerly accepted my offer. But again, everyone's different. But personally, I would not wait.
I would say it's your life, it's your career. So at the end of the day, we can't tell you what to do, and you know what you really want. Stanford was not, when I applied, Stanford wasn't the only program I applied to, because I was like, okay, let me be realistic, apply to multiple new grad programs. So the other thing I could think to say is apply to multiple programs if you know they have exactly what you want. But it's good to have options. And I biased, but Stanford is one of the best organizations that you could work for. And I think that you can definitely still get to where you want to be in your career through Stanford. They're really great about the professional development. My manager is really outstanding. And she encourages us to tell her, what our goals are, what we want, what we're going through. And I know some of my coworkers who have been, who have shadowed in the ED, who've done shadows in the ICU, who've shadowed at Lucille Packard, and switched to the Children's Hospital because they didn't want to do adult medicine. So you have options. And if you can get into the system, you can always move around in it. So I would encourage you to still apply for Stanford and just make it known what your career path is, what your goals are, and you can make it within the system.
Yeah, I really think Marvin said it best when she said, we don't know what, it's your life, right? It's your life. I really agree with that. I think you have to decide what's most important to you. Is a job in the ICU more important, or is a job at Stanford more important? And once you have an answer to that question, then you kind of make your decision from there. I will say that I think having it in the door at Stanford is a huge advantage to you if you want to work in the ICU at Stanford specifically. But if you don't really particularly care where you work and you just want ICU, there are lots of really good opportunities in this area, all over the country. So just, do some reflection on that.
Thank you.
And then is it Malicio?
Hi, yes, it's Malasho. This question's for the panelists. I'm just wondering how the unit level interviews felt different from the department level interviews, and if you did anything different to prepare for the unit level interviews.
I was still just as nervous at the unit level as I was at the panel. Literally sweat pits forming. But I would say it was less, I was still just as stressed, but you don't have like these exact questions that you need to hit. They've already heard what you've had to say. They think that you're a good candidate. So at this point, when I went into that one, I was like, okay, it's okay to be nervous, but just be yourself. Because at that point, they want to know about you. Going into that interview, you'll know what unit has invited you. So ask them questions about their unit, ask them about what their staff is like, figure out what the manager expects from you, what their thoughts are on work-life balance. But definitely go into that interview prepared to ask them questions in exchange, because if you are going to work for them, you want to make sure that you guys are going to be a good fit. But don't be as nervous, because they already know what you have to bring to the table. But also you still want to, present your best foot forward, because it's still, but I think it's a lot simpler. You're just going into it as yourself and seeing if those works, if you guys are going to mesh, I guess. Sorry, guys.
I don't know how your guys's unit level interviews were, but mine was actually almost a full hour of clinical questions. They did ask about me, like I did the introduction, and toward the end, I was able to ask some questions about the unit and just, how to be successful there. But they ended up asking me some clinical questions, giving me some vital signs and telling me what I would do in response to that. It wasn't anything like, I didn't need to have specific experience, but they asked me, where would someone need to go for a GI bleed, as far as, because I work in medicine on the medicine unit, and just knowing endoscopy was what they were looking for. I was surprised that I knew the answers, because it kind of felt a little bit like NCLEX for me. But that was, I didn't do anything different to prepare for it. I was just didn't know what to expect. I thought maybe more behavioral style questions and just polishing up those, but I think it depends on the unit. And my unit though it gets pretty heavy as far as actual nursing care. So I can see why they asked me that. But mine was more actually clinical than it was just getting to know me.
Yeah, I think I got a few clinical questions, but it was a lot of get to know me type of questions in my interview. So yeah, big difference.
Yeah, I got 7 behavioral questions, and oh my God, it just took forever. Not gonna lie. So have the stories prepared, friends, for that unit interview. I got one question on prioritization where I was given a bunch of vitals, and it was like, okay, figure out that's a sepsis patient, that's a blah 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 patient. That one has some sort of clinical change that's, so it's like, how do you prioritize? But I would say do not forget your behavioral questions. But like it was not like really, for me at least, it was not really intense as far as like the clinical questions. It was pretty basic. And then I think just also remember that you have at least one person in your corner when you get to that unit interview, because the manager who was in the panel interview who then selected you, they chose you, right? They're on your team. They want you to succeed. They already picked you out of a group of people to be like, I want this person on my unit. So you've got that person there on your side already. So just that was kind of like a thing that just helped calm me down for that process.
Thank you. Andrea.
Thank you. That was really helpful.
Hi. Thank you for taking this call. And I had a follow-up to, I believe it's Duncan's question when he said you have one person on your side when you go into the in-person interview. My question is, for that, at that point, are they choosing several people who might be a good fit for that position within the department? That's one question. And that just is because of what Duncan mentioned. But I had a question for all the panelists, which I actually wanted to ask was, when did you feel a little more confident in your skill set? At what point within this 1-year period did you feel more confident?
I'll answer first. I noticed at the 6-month mark, I noticed a shift. I'm a very timid learner, meaning we'll just call it, I like to be safe. And so I am all in my head all the time, and I'm like overcomplicating things that don't need to be overcomplicated. So it takes me probably a little while longer to gain my confidence, even though I know I'm doing things correctly. But at 6 months, so my orientation was 10 weeks. I had a preceptor with me for 10 weeks. And after I got off orientation at the 6-month mark, that's when I was like, okay, I'm kind of getting my groove here. I acknowledge that. And at the 9-month mark, so that was just last month, that's when I noticed, I'm like, man, I got this. There's going to be all kinds of stuff that I'm going to come across that I don't know what to do. But there's so many resources. I mean, I'm a little less out of my head now and more like looking forward to the challenges as opposed to just dreading challenges, which I think for everyone it's going to be a little different. But nine months for me is when I was like, yeah, I'm a nurse.
Good. It's relief.
I think I would say I have a similar experience to Pam. Like 6 months, you start to feel just like you're walking in there and you know what you're doing, you know what your plan for the day is, you know what your flow is. The way my road went for the first 3 months, I had a preceptor at all times. And then the next 3 months, that's when I started being quote unquote on my own. I say that quote unquote just because I had a really great supportive staff. So that doesn't mean once I was on my own, I didn't have lots of questions that I was always asking and just still trying to figure out, oh, okay, like, should this person be NPO for this? Or can they there's just you're going to ask questions at all times throughout the process. I am in an observation unit, which sometimes closes when the census is low. So I'm in a unique position now where maybe every 4 shifts or so, I float off to a different unit. So then I end up on cardiac, and that's not what I usually do. And I'm like, okay, I'm all of a sudden nervous again, as if I'm at my 4 or 5 month mark. But I also am like mentally every day reminding myself, hey, you know what you're doing. Just because it's a different unit and you're seeing different types of things that are more specialized, you're still following your orders, you're still following safety. And if you have any questions, ask your float nurse, ask your charge nurse. And I think what I found too is working in different like parts of the hospitals that people are really supportive. And if you tell them, hey, I'm a new grad, I have this question, no one looks at you funny or is gonna, be like, why don't you know this already? Because you're gonna learn so much just in your first year. And I don't think you stop learning at any point in your nursing career, right? But in regards to confidence, it's just, I think sometimes you gotta fake it till you make it, tell yourself, stand in your Superman pose, whatever hyping yourself up looks like. I encourage you to do it all the time because you're super capable. Having gone through nursing school, you've learned the things you need. Now it's just a matter of, working on perfecting your craft and learning things every day. But
Okay.
yeah, confidence is a funny thing, but
Thank you.
it gets easier.
Yeah, so I know you had 2 parts to your question. I'll do my best to answer the first part, and I don't think I'm like speaking out of turn here when I say that every unit is going to be different as far as how many people they have. Kind of what Carrie was saying about the ICU. It's like each unit has a certain amount of needs. So they may be interviewing a bunch of people, or they may be only interviewing a few people, and that's not information that you'll know. And frankly, like that's not really information that's important for you because like for you going into that interview, you just got to be focusing on what's best for you.
Okay.
And just have that confidence that again there's one person there who wants you to be there. They picked you out of that panel, so they want you to be there. They want you to be successful.
Okay.
So try not to think about the other people. Try to just put that best foot forward for yourself. As far as confidence, I could say okay, November was when I started to feel it. I was like, I've got the groove, I've got the routine. At that point, I had gotten trained on LVADs, which is one of our unit specialties. Those are like heart pumps. So I could there was a while where I couldn't take every patient on the unit. So once I got trained on LVADs, once I got trained on CAD pumps, which is our pulmonary hypertension medication, once I got trained on those, I was like, okay, there's nothing left that this unit can like throw at me that I'm not qualified to take. But of course, it's nursing. Like, we're a cardiac unit, but like, people with heart transplants, they get sick with COVID. So now you've got a COVID patient, but they've got, so it's like, there's always something new. And then at 6 months, you start getting floated and then that's all a whole new thing. So like, you have to always be learning. You have to always, and you also just like can't get complacent, even though you have that confidence. You can't be like, okay, like I got this. I don't even have to think about this anymore. Cause that's when it's like, hold on, something's different. Something's new. I got to ask somebody who knows more than me. And hopefully they'll set you straight.
Thank you all for answering my questions. Appreciate it.
So I'm noticing that we're at our time. So I know there's a few hands up. So I asked you guys if you could put your question in the chat and we'll try to answer that. My colleagues just let me know that there are a couple questions that keep popping up. So they just wanted me to review. So we are still reaching out and inviting candidates for interviews. We do ask that you check your spam or junk mail. Just to make sure you haven't missed anything. If you do accept an interview with a date and time within 24 hours, you should get an automatic auto-generated email with instructions and a Zoom link. So if you have not received that and you secured an interview over 24 hours ago, we ask you to email newgradrn@stanfordhealthcare.org so you get your Zoom link in time. We did have questions about how do we know if we were not selected? So we schedule interviews up until the week before, meaning that we have individuals who are interviewing through other residency programs, which we fully support, and may accept an offer from another residency program. So if they decide not to interview with us, we will fill that spot. So we have candidates who are reached out to up into the week prior. Following panel interviews, if you are not selected, you will get an email letting you know that you were formally not selected for the residency program, but that will not be until after panel interviews have concluded. A lot of people were wondering about the surgical area. So surgical 1 is trauma, ortho, ENT plastics and pain, and GI OB oncology. And then Surge 2 is cardiac, thoracic, heart and lung transplant, abdominal surgery, hepatobiliary, minimally invasive surgery, urology, and I think that's it, stomach. So that's the difference between the panels for Surge 1 and Surge 2. A couple questions we had in the chat. Let me just, and the people who I said, can you put yours in the chat? Hold on one second.
Hey, Carrie, I have one that just
Oh,
I
okay.
think a lot of people were going, they were wondering if they chose ICU as one of their places, and then, you know, we're going to the next one. They just want to know if the same
Yes.
process is followed.
Yes.
I got that a few times. I just want to make sure we
Yes. So
addressed
if you
it.
put ICU as your first, imagine we just took away that and say you put oncology as your second, oncology now becomes your first. So then now you have those 3. Does that make sense? So it's like oncology, if ICU was your second, that went away, and now your third became your second. So it's like we just plucked those away. We did have a question that says, what if we are hired into a unit and we feel like we're not a good fit for that area? Kind of what is that process? So we work with you. You are hired into that position and report to that hiring manager. And so it is not something where it's like, oh, I decided I really didn't like medicine. Can I go work in the surgical area? It's not that seamless because you are hired into a position. So I appreciate that question. One of the things we highly encourage, and I am sure our panelists will say the same, is to, when you are accepting positions or applying, you want to make sure that the place you're going is the right fit for you, right? So Stanford's a really big place. It's fast paced. There's a lot of people. It's a large footprint, and the patients are very high acuity. It is booming. If you thrive in busy and noise and interruption, and you like a lot of people, and that's like, yes, that doesn't stress me out. I feel good. I feel like I can be successful. Great. If you're someone who's like, nope, that sounds actually not great for me. I feel like I would be really stressed and not being able to be my best self. Maybe I would be better to start somewhere where there's not so many people and the footprint isn't so big, and there's not so many providers who change every month and this and that. That is something that would be probably a really perfect pathway. And so there's a lot of different hospitals and organizations and a lot of different specialties. And it's important for your own professional growth and development, but also for your own success, is that, yes, we want you to be the right fit for us, but we also need to be the right fit for you. And so take some time to kind of think about that, and know that the residency program is one avenue. It's one avenue into our organization. We also hire hundreds of nurses through all different programs, all different experiences outside the residency program. My colleague, Letty Cortez, was not a new grad here. She was a new grad in Texas and works here. So people come through all different pathways. So take a couple minutes to think about that. I want to thank our panelists, Marvin and Duncan and Pam. They are awesome nurse residents, hence why we chose them, and they have great energy and they have been highly successful. And so if you're thinking, who are the people that are hired? These are the people that are hired. So individuals who are all different, with all different education backgrounds, with all different experiences, with all different work experiences, because we are looking for people who are dynamic, who can contribute to our organization and care for our very diverse patients. And so individuals like this are the people that we are excited about and we are hiring. So a huge thank you to the 3 of you for coming on your day off to support these nurse residents. I wish all of you on the call all of the best of luck in all of your future endeavors, whether it be at Stanford or another organization. The nursing profession welcomes you. We're excited to call you our colleagues in nursing, and we know that the impact you're going to make is going to be great. So congratulations if you have recently graduated or close to graduation. And if you are on your way to take that NCLEX and you're super nervous, this is what I'm going to say to you. You answer the question. You don't come back to the question. Your first answer is always your right answer, and you move forward. And that's what I'll say to that. So thank you all. Have a wonderful afternoon. And we hope our paths cross in the future. Take care.
Thank you so much, you guys.